talk about autoimmune disorders. So let's get started. So to begin with, let's start with a basic definition of autoimmunity. What is autoimmunity? This is immunity to yourself, and this occurs when the immune system attacks you by mistake. It destroys healthy body tissue. So how would we describe these diseases in more detail? We can say that they are chronic inflammatory diseases with genetic predisposition and environmental modulation, and they are affecting mostly women. This is 75% of the cases. So what is the prevalence for autoimmune diseases in the United States? 5 to 8%. And can you think of some examples of autoimmune diseases? How about Sjogren's syndrome, rheumatic fever, Goodpasture syndrome, diabetes, Addison's disease, autoimmune oophorytis, autoimmune hepatitis, rheumatoid arthritis, ulcerative colitis, autoimmune hemolytic anemia, to name a few. So when we think about autoimmune difficulties, they can be classified as being either organ-specific or systemic. So what I'll do is I will name some of these and you will guess whether they are organ-specific or systemic autoimmune diseases. Okay, how about type 1 diabetes mellitus? That's organ-specific. Scleroderma, systemic. Graves' disease or Hashimoto's thyroiditis. These are organ-specific. How about myasthenia gravis? Organ-specific. How about lupus or primary Sjogren's syndrome? Those are both systemic. How about multiple sclerosis? This is organ-specific. And how about polymyositis? This is also systemic. So that's just naming a few, so we should realize which are systemic and which are organ-specific. Now for some of these we have a genetic predisposition, and others are caused mostly by infection and environmental exposure. Others are a combination. So remember that some autoimmune diseases have a genetic component and are triggered by external factors, and others are probably strictly caused by external factors. However, generally we find that they are a combination of both. Okay, let's start with a true or false question. A single gene mutation leads to a single autoimmune disease. No, actually this is the exception rather than the rule. Generally, we find that autoimmune diseases are not easily classified, and we would say that they are complex. What are some examples of how autoimmunity can be caused? They can be immunological, genetic, viral, drug-induced, or hormonal. And many mechanisms cause abnormal B or T cell activation. However, we should remember that most examples of autoimmune diseases are a combination, multiple mechanisms, and that is why treatment is difficult. Let's think about the complement system. How can the complement system be both good and bad for us? How can it be a mediator in both the pathogenesis and prevention of immune complex diseases? Well, first, it has a protective effect when it is functioning in moderation against pathogens. And at the same time, the inflammation promoted by complement activation can result in cellular damage when not kept in check. An example of this would be lupus. Can we classify autoimmune diseases as either B or T cell difficulties? No. Remember that it's very difficult to classify autoimmunity as being either strictly B or T cell mediated, because multiple arms of the immune system are involved. Now let's think about how infections can break tolerance. Let's think about the mechanism, the effect, and an example. So let's start with interstitial nephritis, for example. What is the mechanism? Well, in this situation, there is a binding of a pathogen to a self-protein, and the effect is the pathogen acts as a carrier to allow anti-self response. How about for rheumatic fever, diabetes, and multiple sclerosis? What is the mechanism? Here there would be molecular mimicry, where the body is attempting to do something good and then by mistake attacks self. So the effect here would be a production of cross-reactive antibodies or T cells. How about rheumatoid arthritis? In this case, the mechanism would be a superantigen, and the effect would be polyclonal activation of autoreactive T cells. Now let's think a little bit about infections and tissue damage. Think about the associations of infection with immune-mediated tissue damage. So let's say the name of the infection, or for example, the bacteria involved, and the consequence. And perhaps we can mention the HLA association. Let's start with group A, Streptococcus. What would be the consequence here? Well, this may lead to rheumatic fever. How about chlamydia, trachomatis? The consequence here could be Reiter syndrome, arthritis. And the HLA association here with Reiter syndrome is HLA-B27. How about with Shigella, Flexneri, Salmonella, Tymphimurium, and Salmonarian teratiditis, Yersinia enterolytica, and Campylobacter jejuni? What consequence might you have here? You could have reactive arthritis, and the HLA association here would be HLA-B27. Okay, how about if you have an infection with Borrelia burgdorferi? You remember that this is associated with Lyme disease, so there could be chronic arthritis in Lyme disease. And the HLA association here is HLA-DR2 or DR4. Now we can relate an association of an HLA serotype with the susceptibility to getting an autoimmune disease. So the higher the risk, the more likely you're going to get it, obviously. So, for example, if you have if the disease is ankylosing spondylitis, the HLA allele is B27, and here the relative risk is 87.4. So that's a very high risk if you have this HLA gene, this HLA allele. And so the disease here would be ankylosing spondylitis. In this case, the risk is very high. However, with multiple sclerosis, the relative risk, if you have the HLA allele DR2, is only 4.8. So we can look at the associations of the HLA serotype, and we can make some prediction as to whether someone has a good chance of catching the disease. Another example would be Graves' disease, and the HLA allele here is DR3. The relative risk is 3.7, which is very low. Let's think now about a classical example of an autoimmune difficulty problem where there is molecular mimicry. So what is molecular mimicry? This is when the body is attempting to work against a certain protein or a certain antigen, and by mistake attacks an antigen that is, or a protein that is connected with a self, causing a great deal of problems. And a good example here would be rheumatic fever. So what happens is group A strep is present in throat infection, and it expresses a large amount of an M protein. And then large amounts of IgG are produced against the M protein in the strep. However, the antibodies against the M protein can bind to molecules on cardiac cells that are very similar to the M protein. And then we would have antibody-induced injury to heart valves and the sarcolemma. And this attack happened because of the similarity that the M proteins are expressed both against the M protein on the strep and also on the heart valves. Now, are there sex-based differences in autoimmunity? Let's think about estrogen and testosterone. How are sex-based differences expressed in these cases? So let's think about estrogen, and in the case of women, they are more prone to autoimmune diseases, primarily because their bodies are more reactive, their immune systems are more reactive. So this is because the estrogen stimulates prolactin secretion, which helps regulate the immune response, and also stimulates the gene for corticotropin releasing hormone that promotes cortisol secretion. And one more thing about estrogen is that it causes more Th1 dominated immune responses, which also promotes inflammation. Now, thinking about testosterone, this can cause autoimmunity or protect against it. So some of the differences can be traced to the sex hormones. So let's talk about just some generalities that we can say about these sex differences that can be traced to the sex hormones in relation to autoimmunity. In general, it can be said that estrogen can trigger autoimmunity, whereas testosterone can protect against it. And how about the difference in the immune response? Well, first, females produce a higher titer of antibodies and mount more vigorous immune responses than males. And they have a slightly higher cortisol secretion than males, and females have higher levels of CD4 T cells and serum IgM. So why is this important? Remember that IgM is the first immunoglobulin secreted, the first one that comes to the rescue, and it is very high in serum. Wait, let's back up there again. I said IgM is very high in serum. Let's talk about a little bit more about IgM. We said that IgM is the first responder, so in acute reactions, but for IgG, remember, that is more for chronic reactions. So what do we know about IgM? Well, it's on the surface of B cells along with IgD, and it is secreted. It eliminates pathogens in the early stages, and it is related to complement activation and naive B cell receptors. But the major point here is just to remember that females have higher levels or CD4 cells and serum IgM in comparison to males. So females have higher level of serum IgM than males.